Welcome to another episode of Let's Get Vaccinated, where each week we deliver a healthy shot of science and facts. We do two things on this show. We answer your questions about vaccines and the pandemic, and we learn how to effectively communicate science, because sharing science is how we keep our communities safe. In case you don't know me, my name is Dr. Neecey Hudson. I'm a computational biologist with a PhD in bioengineering, biostatistics, and bioinformatics. I'm the chair and science director at Hood Medicine Initiative, a guerrilla science nonprofit public health collective advocating for healthcare equity for all. And I'm super excited to be guest hosting tonight. For a little bit of recent news, it's only Monday, but there's plenty to cover. While the emergency responses to Hurricane Ida and the still raging multiple fires across the West Coast are complicating the already overtaxed healthcare and community resource capacity in those regions, the EU is actually recommending travel restrictions for those traveling from the US due to our recent spike, obviously, in COVID cases and overwhelming resistance to vaccination. I'm sorry, that was just funny when I said it. Our daily average at this point for new infections is 155,000, not counting the unreported cases. So as you can see, there's us over there at the end in August. America first, as usual. We're off the safe travel list, or at least that's the recommendation. And they're planning to restrict travel to vaccinated passengers only, which is a good thing. Good for them for protecting their populace. We're also hearing a lot about ivermectin. No questions this week about it, thank goodness. I'm glad, hopefully we learned all about that last week, but it is making the rounds again as reports of bottles flying off the shelves at feed supply and pet stores. People have taken the scant evidence from one preprint on some clinical trials as gospel, despite the persistent warnings from WHO, CDC, and FDA against using drugs for unapproved applications without medical prescriptions, and for that matter, drugs intended for other species. And so just this week, a judge in Ohio decided to mandate treating a patient with ivermectin because his wife, became, convinced by a couple of snake oil salesmen, apparently, that was going to be the best thing for his treatment. So she took it to court and they mandated that they treat him with it, even though it's not even approved. And I don't understand how that maths, because the biggest complaint about the vaccine from anti-vaxxers and those resistant to taking it is that it's not approved by the FDA. I don't know. I'm a computational scientist. I don't math right. I might need more training. But that's a huge part of this crisis, right? It's disinformation and misinformation. It's been this parallel plague to the COVID pandemic, spreading further and faster than any mutant variant. It's made public health recommendations extremely difficult to communicate, especially with sort of the complexity of the content that needs to be relayed to the population. So when you have political influence, which is making it harder to cut through the noise, a number of dedicated scientists, in spite of this, and healthcare professionals have risen up to the task to try to fill that gap. Joining us today are some of my favorite fellow science activists, Dr. Andrea Love and Dr. Jess Steier from the Unbiased Science podcast, which is a podcast and a movement devoted to objective, critical appraisal of evidence on health topics relevant to listeners' daily lives. And I'm so excited to have you guys on tonight. How are you doing?
Hi, Neecey.
Excited to be here. Feeling is mutual. We love you.
We're also joined by Dr. Emily Hotez, who's a developmental researcher and assistant professor of medicine at UCLA. And she's been focused during the pandemic on public health education tailored for neurodiverse and disabled people. So thank you so much for coming, Emily.
Hi, everyone. Thanks for having me.
I've been really looking forward to this episode because I know that we've all kind of been having these conversations about the challenges, the burnout, feeling like a town crier farting in the wind. And, I think, but at the same time, it's like, we're not going to stop. So it's important that we kind of also seize that momentum of this time when there's so many people who have like stepped up to the task, and so many scientists have kind of, you know, been inspired to, you know, step in and make up for the lack of clear communication from our government and the people who should be guiding us through this crisis. So I thought I would start with you, Andrea, and just kind of tell me a little bit about your background and kind of how Unbiased Science Podcast got started.
Yeah, no, absolutely. So I have a PhD in microbiology and immunology. And so my research, my interest has always been in infectious disease immunology with a focus on human diseases. And, throughout my training, throughout my career, I've always been frustrated with the dearth of accessible science information to the general public. I think the most prominent example of that has always been the anti-vaccine movement. And, this is not unique to the current COVID-19 pandemic. The anti-vaccine movement has existed for many, many years. And Jess and I, and she'll tell you in just a minute, we went to undergrad together and we took different career paths. She's a public health scientist and I do biomedical science research. But we have always stayed in touch after undergrad, and we kind of always shared similar frustrations. And we had talked about, we should join forces someday in a way to bring science to the masses. And, life got in the way. We were developing our own careers, raising families and all of those sorts of things. And there was really never a great time to spearhead it. And ultimately, once the pandemic hit, we found ourselves sharing information and clarifying misinformation on our own personal social media pages. And we decided, hey, there's never going to be a great time, but we have this moral obligation as scientists, as the literal experts in these fields associated with an infectious disease pandemic, that we really just needed to do it. And so we created the Unbiased Science Podcast, which is a podcast. There are 40 episodes already available, but we also do a lot of social media science communication efforts in order to obviously debunk misinformation, dispel myths and pseudoscience, but also provide general education in the sciences to people, arm people to be better consumers of information they find online.
And Jess, what do you think has been like the most rewarding thing? Let's start on a positive note. Today about getting into this endeavor.
Well, I think we really are making a difference. How many messages do we get, Andrea, where, people will say, I don't know who to trust, and I came upon your page. You guys are experts in the field, and you convinced me, or you helped me speak to my father or my cousin or my friend, and you helped us make the informed decision to go ahead and get vaccinated. So I think it's just really seeing that we are having an impact. And, I know we're all exhausted. We're so frustrated. We feel like we're repeating ourselves, but it's paying off. People are listening. I know we're going to talk more about this, but it's just that real world impact that I know that we are making. It's just incredible.
And Emily, maybe you could jump in and tell us a little bit about your work with UC Lend and Neurodiversity Health Chats and kind of how you came into this space.
Sure, happy to. So just by way of background, I'm an assistant professor of medicine at UCLA. So I have a kind of a vantage point as a researcher in all of this. I'm a developmental psychologist by training, but I'm also the sister of an autistic adult. My sister Rachel has autism, and she has inspired and continues to inspire a lot of my work. So I have this unique perspective on issues of vaccine access and uptake, because I read the research every day. I'm steeped in the literature, but I also see some of the challenges that often marginalized groups experience on the ground. These challenges were certainly put under a microscope during COVID. We've really seen firsthand a lot of the disparities that people with disabilities face, and other marginalized groups. But these disparities have always been here. And people with disabilities face countless access and information access, healthcare access, all kinds of access issues. And we witnessed this during the pandemic, but these challenges have always been there. So being a developmental psychologist and a sister of an autistic adult really allowed me to understand how we might approach issues of vaccine access and uptake in marginalized communities during the pandemic. So having that vantage point and also being very well positioned at UCLA, working on an interdisciplinary team of scientists. So I work with physicians, researchers, psychologists, and clinicians. I really felt that I was perfectly aligned to make a difference in increasing vaccine confidence and access and uptake in disability communities, neurodivergent communities. So we were fortunate, my team and I, to receive funding from the CDC and the Association of University Centers on Disabilities, or AUCD, to try to increase vaccine access and uptake in neurodivergent communities by the anniversary of the Americans with Disability Act, the ADA, which was the end of July. We were given a very short turnaround, 2 months, to make it happen. And we kind of took this in 2 steps. First, we recognized we didn't fully understand vaccine hesitancy or barriers to vaccine uptake in the disability community, which is certainly the case for many marginalized groups. And I really wanted to empower students at UCLA to take the reins and have a leadership position in this project. So I had many students conducting interviews with diverse stakeholders, including individuals with disabilities themselves, family members, direct service providers, public health experts, and scientists to really better understand the issue. And then we also had the advantage of learning from the community that we're hoping to serve. And that's an approach that Neecey at Hood Medicine takes, and many others. And that was really a strong advantage in our project. So then we took what we learned, and we realized we had to get the lessons learned out to the public. It's not just enough to simply convey our lessons learned to the public. We had to be really strategic public health messengers. And that's where Hood Medicine came in. We learned quite a lot of lessons about promoting vaccine confidence and uptake in neurodivergent communities, but also in intersectionally marginalized communities. And so we gleaned quite a bit of lessons learned about facilitators, barriers, and other recommendations that scientists can follow, as well as others. Happy to talk more about that as well.
Yeah, that was an amazing experience, honestly. The group is amazing, and I'm so excited to see how that develops as we move kind of beyond the pandemic. We are definitely focused, obviously, on intersectional communities as well. And I know that Unbiased Science Pod is trying to kind of expand the people and the populations that they target as well. But just, I wondered, if you could talk a little bit about your sort of approach to messaging in general, in terms of how you decide to which topics you're going to choose to talk about, and then how you decide to kind of structure the information that you provide.
Yeah, was that to me? Sorry, I don't know if it was to me or to. Sorry. Andrea's not answering, so I must have been to me. I love, Emily, how you said you're just steeped in all things COVID. We are as well. We're monitoring social media, and it's sort of like a really informal qualitative analysis of all the posts, and we're sort of trying to identify trends in misinformation or hesitancy. It's not reasons for hesitancy among different populations. And we're also monitoring news outlets, headlines. And so, it's so funny. We often get frustrated because we feel like we're responding to so much misinformation. Like, it would be so nice if we could just get ahead of it and educate from the onset, but often we're, it's defensive, right? Well, I should say it's reactive, excuse me. And so I think that, right, Andrea, wouldn't you say that guides so much of our messaging? We're also trying to keep track of where there still exists a lot of vaccine hesitancy, and which groups we could possibly / probably reach. So, there's a group of people, we often talk about them, who are more prone to believing conspiracy theories, who maybe are harder to reach, who just have this distrust of the medical and scientific establishment. But there are certain populations, like pregnant people, for example, where we're just not seeing the vaccine uptake, and we know that there's such a high-risk population. So we've chosen to focus so many of our posts on things like fertility and safety of getting vaccinated during pregnancy. Andrea, anything else? I'm just spitballing here.
Yeah, I mean, I think, we're trying to reach as many different populations that have different reasons for hesitancy. And some of that is, politically motivated. Some of that is religious. Some of that is because they're a high risk group. Some of that is because they have a pre-existing condition. And so some of the content we put together is designed to be just kind of broadly educational, but some is framed very specifically. So, we are taking different tactics because some people are not super receptive to the hard data. They need a little bit of an appeal to emotion, or maybe they need a little bit of, the Pope is encouraging you to do this because this is your way of showing love for your neighbors, so that maybe will resonate with Catholics or other, sects of Christianity. And so, we're trying to kind of feel the waters and see where there are still pockets of hesitancy and maybe utilize the same sort of data. Everything that we share is backed by data, but frame it in ways that are going to resonate with some of these groups that have still not yet gotten vaccinated.
Emily, what are the sort of underlying reasons for hesitancy among the populations that you work with?
Yeah, and Jess and Andrea bring up a great point. It's what we've been finding too is having messages coming from the experts, physicians, public health experts. This is all really important, but it's also equally important to have messages coming from the communities that people identify with, and really having those messages that are culturally salient to them. And that's something that Hood Medicine does really, really well, right? Is really engage the community in order to better understand and direct their public health messages. In our project, we spent more than half of the time, while we wanted to use social media to get the word out about vaccines, we spent more than half of our time really trying to understand the disability community and their experiences during COVID, and why or why not are they getting the vaccine? Will they get the vaccine? What kinds of barriers to access are they experiencing? Sure, there are disability-specific barriers to access, like certain sensory challenges and anxieties, but there are barriers to access that this community talked about that we know many marginalized communities face in healthcare, related to doctor-patient communication and access to reliable healthcare, and a lot of these barriers are based in again, things that were present well before the pandemic and will continue beyond the pandemic. The pandemic just really brought a lot of this to the forefront of public discourse. We know that many marginalized groups have experienced a long history of stigma across the life course. Of course, in healthcare settings, but in schools, we know kids as young as 7 are already thinking about kids with ADHD and learning disabilities as people they don't want to hang out with. So all of this has such a snowball effect on how they experience health throughout the life course. So these when we're thinking about public health messages and we're thinking about mistrust of healthcare systems or government systems, we do have to remember that this mistrust is oftentimes so ingrained because it has existed for decades, often for many marginalized groups.
Yeah, that's true. That's probably one of our biggest barriers in messaging to BIPOC communities, because the the mistrust is so well earned, you know, from unethical human experimentation from like slavery up until, I don't know, the early 1900s, and then medical apartheid until now. You know, it's really difficult, even as you know, like as we try to establish ourselves as trusted messengers. There's so much distrust still for science, for the message, that sometimes we're rejected as messengers, even though the very purpose for some of us pursuing our careers in science and medicine was to like, kind of like fill that gap and like use science to like service our communities and to, you know, encourage other, you know, be an example for like STEM advocacy, that kind of thing. It's like, I just never would imagine in a million years that I would have, you know, worked so hard through, you know, honestly, a lot of challenges. You know, it's not easy for us even now to access careers in science and medicine. And then to sort of think, oh, here's this chance, you know, like we can like definitely help our people and help people like understand what's going on and everything's going to be great. And then it's just like not at all how I expected things to be going by late fall of 2021.
Well, and I think it's, you know, Neecey, you bring up a great point, because, you know, even for you as a Black woman in the science community, I think it's hard for a lot of these populations that have mistrust to separate the institution of science or hospitals or healthcare from the people, the individuals that are choosing to go into this as an insider to affect change from within, right? And, you know, I'm sure you get a lot of the same accusations of being a shill or being, you know, bought and paid for. And it's, you know, it's how do you resolve that, right? How do you get people to kind of understand that, you know, there are some obviously systemic issues in the healthcare industry, in the pharmaceutical industries and things like that. But that's not where this information is coming from. This information is coming from individuals who have kind of devoted their careers to be stewards of, you know, data and science.
Yeah, it's unfortunate. I wasn't really expecting it to go like this at all, honestly. There is a lot of, even in our community, is a lot of that sort of religiosity baked into it in a lot of segments as well. So that makes it even harder to overcome, because some people do honestly either believe they're just gonna like sort of put it in the hands of God and they don't need a mask. And then some people really honestly believe that the vaccine is like the mark of the devil. It sounds ridiculous to say out loud, but it's true. And, you know, I feel like we have to address it at some point to kind of like start chipping away at that delusion if we want to get through to people. I don't know. What are you guys finding in terms of what resonates most with people, like with your content? Like Jess, for example, what do you think?
Yeah.
Are people like resonating more with the informational things? Or are they connecting with some of the emotional messaging?
There's such a divide. Really, it's so interesting that people have very strong opinions on everything that we post. And no matter what we post, no matter what tactic we try to use, we're doing it wrong.
Yeah.
There's definitely a group of people, and I tend to think these are people who have some background in science or who don't have that mistrust, who, when we present the statistics, that's what resonates. They want to see the facts, they want to understand the studies. And then, for others, it doesn't matter how many statistics we cite, is the data are all faked. So no matter what we say, it's all a lie, right, in their minds. And for those people, when we talk about things like, we had a post on how many children have lost parents or grandparent caregivers. Andrea said when we try to appeal to emotion. But there are always the naysayers. It really depends. I see a lot of parents that seem anything having to do with children, that seems to be, that's definitely, that gets their attention. So even if they're not worried about themselves, let's say they're worried about their families. It really depends. And I think that's what makes our job as scientific communicators so difficult. There's no one size fits all. We're trying so many different things, and this is new territory. Who's dealt with a pandemic, let alone a pandemic in the time of social media, when we're going up against people who have no expertise and who are given this platform and this false sense of confidence to put out misinformation? It's just, I don't know. Difficult.
Yeah, I'd actually like to echo what Jess said with the lack of one size fits all approach. And that's actually something, recognizing that approach has actually been a message that has really resonated with the neurodivergent communities that we've been speaking with. So much of healthcare is we've sort of tried to make it a one size fits all approach. We have all of these protocols in doctors' offices, and this is what's supposed to work for everybody. And we hear from neurodivergent communities that say doctors' offices are built for doctors and not for patients. They will talk about how doctors do not understand their experiences, and it's true, doctors oftentimes request much more training in working with the disability community, because this is often an oversight in medical education. But the people that I work with really appreciate when healthcare providers do not take that one size fits all approach. One self-advocate that we spoke with as part of the project said, the person giving me the shot sat down and said, what can I do to make this experience more pleasant or more comfortable for you? And that is not something that I hear every day. So I think kind of embracing this flexible approach, which is often called, precision medicine, or what I call a neurodiversity oriented approach to medicine. I think that can be a facilitator.
And since you guys launched in July, have you gotten a lot of feedback? Are you getting a lot of this resistant sort of feedback, or are people really just kind of responding to it and taking it in, do you think?
For my project?
Yeah, for the neurodiversity health chats.
Yeah, we're really lucky to have heard from a really wide range of stakeholders in this issue. So we are getting positive feedback because we're representing the self-advocates, but we're also representing family members and direct service providers and public health experts and physicians. Obviously, our short-term it was called a mini grant. So the potential for reach is, of course, mini in many ways. But we're hoping that we've really laid the foundation for larger initiatives that can build off of what we've learned. So they're not building from the ground up. They're really starting from a place informed by the people that we're trying to serve.
Andrea, did you want to say something?
I obviously echo all of what Emily and Jess are saying. I think, we get different populations that engage with different formats of messaging, and I think we've really adjusted how we frame things since we launched a little over a year ago, and we try and present the same sort of data multiple different ways, not necessarily back to back, but over the course of a short time period, because some people like the hard data. Some people don't want to sift through the numbers and they just want the, one thing we've been doing recently is we'll have like a summary slide or a TLDR slide, so that the people who don't want to read, the carousel of infographics can just get the big, high level points. And I think that seems to be appreciated by a lot of people.
And if I could just jump in, Andrew, we often comment that it takes several hours, if not days, to develop all of our infographics. So much time goes into researching, evaluating the evidence, putting together the graphics. And it's like the graphics that take the longest amount of time and have the most information seem to not do as well as those that we just throw together with the high level.
Right?
Are you kidding me? It's so frustrating.
Totally.
One other thing that I want to, I'm sorry.
Yeah, it's so true.
So true, right? And one other thing, we're talking about how there's no one size fits all in terms of messaging. And I see, Andrea, don't you notice whenever we use the term anti-vaxxer, people don't like to be lumped together in that category. That's another thing that seems to really turn people off, because they'll say that they're vaccine hesitant, they have questions, they really are there, they will listen to experts. And I think the cool thing about what we're all doing is that how often, in what other decade would people have access to biostatisticians and immunologists and epidemiologists? It's awesome that lay people have access to people with such highly specialized expertise. So,
and I think we try and be kind of cognizant of the anti-vax label, and we say those that are opposed to vaccines or those that are hesitant about getting vaccinated, because we don't want to lump everybody into that same bucket. We know that there are true conspiracy theorists who think that there are microchips in a vaccine when they're carrying around a cell phone that has a legitimate microchip in it. But there are people who have children and they're concerned about their children's future fertility because they heard something scary on the internet. And so, we want to be this trusted and reliable resource, and we don't want to turn them off, so to speak, by branding them.
Mm-hmm. I think it might be a good time to get into some of the questions, because kind of fits right into what we're talking about. So we have a number of questions that we've collected from the community ahead of time, but we've got a couple of good ones in the live chat too, so we're gonna get into those. I think I want to start with Jack Shaw, who just submitted a question, and he says, regarding hesitancy to scientific information, many fields of science seem cloistered with little transparency. Do you see this as an issue that needs to be addressed within the sciences? I see you nodding, Jess.
Yes, I mean, absolutely. I think that's one of the biggest reasons that people mistrust science. That everyone thinks that there's some ulterior motive, that it's all funded by pharma, and that all the data have been tainted, and we're all sort of being paid to disseminate a certain message. So many of our messages emphasize this, we're very transparent about our own backgrounds and how we are not receiving funding. All of the studies that we appraise, we always look to see, are there conflicts of interest? Are there red flags with regard to funding? And one of the things we've done actually is, the dirty dozen people who spread misinformation. One of the things that we've done is really highlight, let's be transparent about their conflicts of interest, and how these people are often lauded as these heroic whistleblowers who are going against pharma and the scientific establishment. Really, they're profiting, they're making millions, they're selling their own supplements, their own products. So I think that's key. This transparency is a way that we can regain trust with the public.
And I think, I would echo that for sure. And I think maybe transparency with regard to how research and development is conducted and how drugs are reviewed and approved and things like that. But I also see a little bit of a challenge, because we're seeing the issue with too much transparency during this pandemic, where preprints or non-peer-reviewed studies are getting on the internet, and people who are not trained to evaluate science are getting their hands on them. And because they haven't been evaluated for robustness of study design or whether or not the research model is even appropriate, it's getting wildly misinterpreted. And then that becomes this false flag of, oh, well, this study said this, even though 20 other studies say the opposite. And then we have to spend a lot of time kind of trying to walk it back once the box has already been opened. So I think, there are specific things in science that, stay in the realm of science, just like any specialty, right? Like, you're not going to be able to understand the complexity of any field if you're not an expert in it. But I do think that we need more transparency in terms of how research is designed, how drugs are approved, what sort of, gatekeepers and checkpoints are there, so that people can have more confidence in these medications or these treatments that they ultimately are going to get.
Agree. So transparency is definitely an issue, but I agree there's quite a lot of information being funneled throughout the interwebs. And so a key responsibility of scientists, and this has always been a responsibility of scientists, but it's more important than ever, is in translation. So how do we help the public accurately translate research findings into conclusions that they should draw about their own lives? And that seems to be more important than ever now.
Yeah, that definitely leads into the next question from Casey Clank and Dalen. I hope I said that right. But yeah, so it's just with so much conflicting information, is it a time for a more nuanced approach to where we acknowledge that there are no absolutes? I think, like what you were saying, Andrea, with like the preprint surge, let's say this has been happening lately. It is frustrating for something like ivermectin, right? Because people start to see like, these reports that imply a benefit with like really scant data we don't really know. And then, we've seen some meta-analysis that say that they're like modestly certain, have moderate certainty, or low certainty, you know what I'm saying, with regards to like the obvious need to kind of let people know to like temper that with, hey, like we need to like really flesh this out. They just kind of are letting us know. But on the other hand, it's like those preprints have been really great in the field of like computational epidemiology, because you need to get those numbers out to people like quick. And so it's like a double-edged sword, I think, because there's some things that it's kind of served us better to have, up to the minute, and other things obviously really need 2 or 3 peer reviews.
Yeah. Well, then that's exactly the point, right? Like, so the preprints or, bypassing the peer review has been great for cross-pollination, for joining forces, for researchers, for all of these like high throughput repurposing screens for possible compounds that might have antiviral efficacy. But at the same time, if they get into the hands of a person that is not a scientist, then they get ultimately misinterpreted. But and Jess and I are saying all the time, a lot of these statements that come from government officials or kind of figureheads, they lack this nuance, right? It's an all or nothing phenomenon, and they aren't explaining the science in a way that kind of fully represents the picture. And I get it that there's limited information that people can absorb and kind of process quickly, but I do think that people need to understand that science is evolving, and the fact that we are revising guidelines as we get new data is not flip-flopping. It's the nuance associated with the scientific process.
Mm-hmm.
Yeah, I think just as important as scientists kind of upholding their responsibility and making sure that their findings are being put out to the public in a responsible way, I think more than ever we're going to see scientific literacy and critical thinking being promoted in schools, because these are skills that are going to be so important for everybody moving forward.
From your mouth, Emily.
I was gonna say, Emily, like, I love this because, you know, obviously the challenges we're seeing right now with the uptake or lack of uptake of science it comes systemically, right? It's the failure of educational systems. It's a disproportionate focus on passing these standardized tests without any sort of critical thinking training. It's you know, this lack of kind of intellectual curiosity, or only reading the top line of news articles and not reading the actual text of it. And I think you're absolutely right. Like, we have to reorient the focus on education.
That's a longer term solution. Some of the public health messaging that we're talking about, maybe we can tackle it all at once.
Let's see. Our next question is from Julie Cornell, and she asks, "How might best practices differ between best communication practices differ between a layperson audience versus informing or persuading policymakers?" And so she is wondering which strategies, for example, is it repetition, personal narrative, etc., might be recommended for widely disparate audiences, that kind of persuasive piece, versus how do we persuade policymakers who actually can have the influence to, you know, because as we've seen, you know, we're not going to be able to do this by the honor system, not for masking, not for vaccination. People need to be guided as much as they keep calling us sheep. I can't. You know what? Somebody answer the question.
I can speak a little bit to this based on what I've been seeing with the pandemic. You know, at the very beginning of the pandemic, we saw these vaccine prioritization guidelines, and my colleagues and I were, I guess, disheartened is not quite conveying the emotion, but disheartened to see that individuals with most disabilities were excluded from receiving priority vaccines. And that was a policy decision that reflects a longstanding history of marginalization against this community. And in part, it's because there wasn't data to support that people with, for example, ADHD or autism should receive priority vaccines, because these people have been historically excluded from research studies. I came across an article that found that people with intellectual or developmental disabilities were only included in 2% of medical trials in the top tier medical journals, and were often excluded based on arbitrary reasons, and they could have been included. And so if we don't have research and data on these populations, they're being excluded from policies that really play an important role in their lives. So I think when speaking to policymakers, having that data is really important, but then it's up to the researchers to make sure that their studies are equitable and not perpetuating disparities.
That's an excellent point. It's true for so many things too, right? Like, because I feel like people have this impression that you could still get a mad scientist in this day and age. Do you know what I mean? And it's like, and it's precisely because there's so many physicians who deliver humiliating experiences to so many like marginalized patient populations in the exam room, coupled with all of that history and all of that sort of instinctual fear. And I think it makes it difficult for people to not only to trust, but to understand that the information that they're getting is not coming from a corrupt place. I think people, you know, kind of, especially in, like, for example, the Black community, you know, we've heard a lot about like Tuskegee, for example, and people like literally still think we could have a Tuskegee today and don't really understand the oversight that's involved in scientific and medical research, where you have, I mean, they should by now, looking at the world's largest clinical trial that there ever was. But I think people still get this sense of like, there's something nefarious going on in science, not realizing that we are held to the highest standard of any other profession. And really, it's in medical practice where it's extremely difficult to even like file a complaint against a doctor. And I'm here to tell you like firsthand. And it's really a grueling emotional process to go through. And I'm a PhD scientist. I speak the lingo. I'm in there. I did my PhD in the School of Pharmacology and Toxicology. So I know the drugs. I'm in there talking my shtick and everything, and people still blow me off and don't give me the treatment that I need and harm me further by disregarding when I tell them about my health. So I know if that's happening to me, it happens to other people. And so it just continues a cycle of distrust where they start to conflate medicine and scientific research. And now we're at this place where everyone thinks that because we can still have, like really troubling and harmful experiences in exam where people like withholding treatment and disregarding diagnostics, that you could still get a mad scientist in this day and age, and that you just can't. Like people. It's just, I wish they knew more about the process.
I love that you brought that up, Neecey, because it's something Jess and I talk a lot about, that physicians are physicians and scientists are scientists, and there are some physician scientists and all that, but they're not the same, one and the same, right? Science and scientific research is kind of a separate entity from, physicians and practicing medicine. And, we did a whole podcast episode on human subjects research and kind of past atrocities that led us to where we are, and institutional review boards and all of the paperwork and all of the approvals and all of the oversight that you have to go through now to do any sort of clinical research, because of that, to try and create some of that transparency. But of course it's still problematic. I think it's worth kind of reiterating that. And I think that brings it back to this kind of messaging where when you're talking about speaking to policymakers, the framing has to be for society, right? It has to be kind of this global, this population level guidance. So we need to make sure we include marginalized populations. We include high risk populations. We have all of these tiers. Whereas when you're talking to the general public, the layperson, some of that framing, some of those strategies have to appeal to individuals, right? So you have to have multiple different strategies and styles of messaging because different things are going to resonate with each individual. Whereas your policymakers have to look at it from, okay, well, what is, cost benefit? What is the risk benefit? What is, kind of societal benefit of all these different mitigation or implementation measures that they might be considering?
Yeah. Let's see. I think we probably have mostly science ones left. So I think maybe I'll go to Kara Turner next. And that was from the live chat. And she asks, what are your thoughts on the difference? This is actually a good one. And the difference between smallpox and polio versus COVID vaccines in terms of population getting the vaccines versus rebelling against them.
Well, there have always been anti-vaccine advocates, activists, whatever you want to call them. Even during smallpox, we actually did a couple of posts, one on 4th of July, because we talked about the historical kind of mandates for variolation. So variolation was the rudimentary smallpox vaccination before we actually had, our cowpox vaccine, basically. But George Washington had his troops variolated at Valley Forge, and most of them survived smallpox, whereas other forces, who was it, John Adams up in Quebec, he didn't believe in it, and his troops had to retreat, and they probably lost Quebec as part of the Revolutionary War as a result because of a smallpox outbreak. And, we recently talked about mandates in the context of history, and Boston implemented a smallpox vaccine mandate in the early 1900s, and there were some people that didn't want to get vaccinated, and they tried to sue the health department, and the Supreme Court said, no, the Boston Health Department is able to mandate this. It is constitutional. The good of the many, outweigh your kind of personal freedom, because not getting vaccinated puts you at risk. when we talk about polio, I think something that we're really trying to do here is this kind of public vaccination. So Elvis was a very kind of a key figurehead where he got his polio vaccine like on, you know, on media, right? To kind of show everybody that it was safe, and, you know, Elvis was doing it and be like Elvis. And, you know, we saw a lot of people doing this, right? Like Paul McCartney got his vaccine and put it up on Instagram. You know, all these political figures, religious leaders, people trying to kind of be a good example and encourage people in their communities to get vaccinated. I don't think it's any different now. I just think the reach of social media and misinformation is greater. So I think we have to work that much harder to combat those very loud minority.
I think also it's a little bit to do with the like outward manifestation of disease. I feel like with smallpox and polio, it was clearly physically debilitating. And also, I mean, we know that COVID is too, but people just, I don't know what they think. The hospitals are full, you guys. Right. I don't know what they think, but I feel like everybody just sees this distant possibility. A couple people here and there on ventilators, you guys. Right. It's almost 10 million people have died. It's crazy. Go ahead.
I'm sorry, I was interrupting. I guess the other thing is that you have some people who only have mild illness, so that doesn't help, because then you have the people saying, oh, you know, people who are otherwise young and healthy thinking, oh, I'll just be one of those people where it's just, you know, mild cold or like flu. That's not helping us. You know, they're not thinking about the millions of people who have died. The other thing, I'm sorry, I don't really know if this is a great response to this particular question, but I'm just thinking about the difference between now and then. We have other tools like rapid testing and PCR. You know, we need to also, obviously, we have to keep fighting this vaccine fight. There's no question. But I think we also have to think about these other strategies to help get this. You know, maybe we also need, certainly we have to keep talking about masking and social distancing, but maybe we also need to talk more about more regular testing and rapid testing. And I don't know, it's a crazy time. We have so many tools under our belt and so many people are just refusing all of them that it's how, you know, I don't know how we're going to get through it.
I kind of feel like we have a lack of discipline as well. Maybe I feel like back then, people were more apt to follow recommendations from their leaders.
Yeah, and I think there was more
during the Blitz, people in England turn their lights off every day at dusk. Right. You know what I mean? Like, we don't have that.
Wouldn't happen now. Yeah. Well, and that's also, I think it's not just discipline. It's this sense of duty to your community. You know, there's this kind of pervasive, like, well, my convenience supersedes my responsibility as a member of society. And I'm not really sure where that came from or when it came about, but, you know, it's this, you know, well, I don't want to put myself out, you know, for an inconvenience in order to make someone else safer. And I think that has become very pervasive and to a degree violent. You know, there was a school board meeting in my district, and parents who refused to mask, you know, barged in and they coughed in the faces of other parents that were at the meeting who were wearing masks, just like to be defiant. And yeah, I mean, I think that's a big issue here. People feel very entitled to do these sorts of things because there really aren't repercussions.
I feel like that's one of those examples of how Black people live by the wish creed. How, like, I really wish somebody would come up to me and do that. Just one time. We have another question.
Come here, Neecey. Come here and you can experience it.
We have another question from Susan Harris Browder. She asks, the eternal question, why do we wear a mask? Please explain again why vaccinated people need to wear a mask.
I know Andrew's got here. She literally just bit her lip because she has so much to say about that.
No, I'm going to let someone else take it.
Oh, okay.
I know. Andrew's got a lot to say.
I always have a lot.
Make it simple. Here's a simple version.
All right.
Too long, don't read. We spit in each other's mouths all day long. That's the simple lesson from the plague, is how much we spit in each other's mouths all day long. Okay, and the thing is with Delta, which is now the predominant strain, thanks to you guys, congratulations. It induces like 1,200 times the viral load. So you're going around just puffing out gas clouds to people. We refuse to wear our masks. We refuse social distance. Everybody's at Applebee's. Everyone's at Lollapalooza. I don't know. Why do you not wear a mask is a better question, because I'm not there yet. I don't know if I'll ever be there looking at the true nature of human behavior. I never want to smell anyone's bad breath again. I never want you to accidentally spit on the corner of my mouth talking to me again. I'm good, and don't blow out the birthday candles. None of that. You know, like keep it to
birthday
yourself.
candles are over. But so from the scientific side of the masks are literally a physical barrier. They're a woven material that block those spit droplets that are coming out of your mouth when you talk, when you breathe, when you speak, when you sneeze. And the more of those you block, the less likely any of those that may or may not have virus inside of them are going to get into someone else's face. And so even when you're vaccinated right now, we know that with Delta, it is not 100%. Well, it never was 100% effective at preventing infection.
Transmission, right.
Yeah, exactly. So with Delta now, which is much more contagious and has way more virus literally growing in your body, there are people who, when they're vaccinated, they can still get infected and in theory pass it to someone else. So until we get Delta under control, our hospitals are overwhelmed with mostly unvaccinated people, but vaccinated people could in theory still pass it to someone else. So we need to get more people vaccinated before we can take the masks off.
Right. And I was just going to say, we know that exactly as Andrea just said, vaccines, they do an incredible job at preventing severe illness, hospitalization, and of course, death. They also, vaccinated people will, if they do get infected, will clear the virus more quickly. The infectious period is shorter. However, you can still carry and transmit the virus. And right now, the community spread of COVID is absolutely rampant. I live in South Florida. Our test positivity is over 20%. We have to get that under control. And so for now, I know it's an inconvenience. I like it because I don't, worry about putting on makeup or having things in my teeth. But we need it to stop. The community spread is just rampant right now.
And I just want to clarify, the vaccines are still very effective at preventing infection. They're just not as high efficacy at preventing infection as they were before Delta. It's still about 80% effective, which is still a phenomenally protective vaccine against infection. You can't expect anything to be 100%. Nothing is.
Well, the thing is, it's about that physical barrier too, though, right? Like a vaccination doesn't create an invisible force field around you. If you walk around with your mouth open, it could still, do you understand?
Something's going to fall in. Yeah.
Okay.
It's the Swiss cheese model. You need multiple layers of protection. Yeah.
But it's like, even in like vaccine studies, where they're evaluating different, vaccines, or like in preclinical medicine with like animals, like even if you have a vaccine, like a tolerance study, if you overwhelm the animal with virus, it's still going to get infected. And we're talking about 1,200 times. You feel me? Not 2 times, not 10 times. I mean, you're still going to get infected just because of the sheer viral load.
Amount of virus. Yep. Absolutely.
And I don't see any of y'all taking precautions. No one in my grocery store wears a mask. Everyone's right up here, right up on each other all day long. So that's, I mean, you know what? Next question. We could do this all night. Wear your mask, Susan. That's the answer. Let's do Karen Anderson next, because this is a great one, and I know that you guys have done a really amazing couple of infographics on this for like kids in school and just for adults. But she asks, is it safe for anyone to be eating inside of restaurants or cafeterias with Delta spreading?
I would not, even vaccinated. I mean, especially, I think it's also place specific. Here I'm in an area where, again, over 20% test positivity. It's just so rampant. Even if I'm vaccinated, I do not want to be indoors with crowds. I'm thinking, especially we're sitting close to each other when we're eating. It just spells disaster. So it's a no for me.
Yeah, I mean, I'm of the same belief. I've very selectively done outdoor dining at restaurants, basically where like there's a table on the sidewalk. But I think it's also what your risk tolerance level is. If you're a family who have unvaccinated children, anything. I think people forget that whatever the lowest amount of mitigation is going on in your household, that's what everybody is exposed to. So if your partner is not vaccinated and goes to the grocery store without a mask on, it doesn't matter if you do, because whatever they're bringing home, they're giving it to you. And so, you have to have a frank conversation with everybody that you're around about, whether or not you feel comfortable with this risk. And right now, Delta is rampant. I think there's not a place in the country that isn't at, high incidence of spread. We know that the virus spreads better in indoor spaces with poor ventilation, particularly as people are chewing and flinging bits of food and mucus. It's going to be a long time before I feel comfortable dining indoors, for sure.
I want to point out that, that I think they've done a little bit of inquiry into the aerosols, and they do stay around quite a bit with these, and they are so concentrated. So even if you go into a room, someone has already left, those particles can still be hanging around. So just because you don't see anyone there, just keep your mask on. I think we have a question from the live chat that we might need to clarify a little bit. So Janet Oliver Chadon asks that, she says 80% against infection. Why do we keep hearing about studies saying Pfizer's all the way down to the 30s?
So,
and I think that's what Andrea was trying to make the distinction between transmission. There's sort of three measures, right? Of like transmission. Severe, almost,
Yeah, and so this study that was circulating, that was one study out of Israel, and Jess and I actually have been reviewing it, and there are a lot of kind of gaps in the data. There's some selection bias going on, and so that's kind of why we have these caveats about preprints. So there was this one study out of Israel that's saying that Pfizer was all the way down to 30%. The data that's demonstrating 80% against infection was a new MMWR, which is a morbidity mortality weekly report coming from the CDC. And this was data collected from hospitals and health departments around the country that were demonstrating that the mRNA vaccines were still very effective against infection, 80% for the general public. It did go down to about 53% for elderly persons in long-term care facilities. And that's why that kind of emerged around the time of the third dose recommendation for those who are immunocompromised, because we know that Delta means that you're shedding that much more virus. So people that have less robust immune responses, like the elderly, like transplant recipients, like people that are on immunosuppressive drugs, that third dose is going to kind of bring them back up to that level of protection that'll protect them against the Delta variant. So I think my takeaway is there was a single study that showed that Pfizer was less effective than Moderna. There was some bias in the statistical analyses and the data they were presenting. The rest of the data that we've seen, including this most recent analysis by the CDC, seems to be that there is a little bit of a reduction, but it's still really protective. And it's very, very protective, above 90% for hospitalization, severe illness, and death.
Yeah. Okay, that kind of covers the rest of the other ones that we had in terms of the other sort of questions people had about the booster shots. So thanks for that. I have a final question for all three of you. I guess I'll start with you, Emily. So how do you feel like your work throughout the pandemic has sort of changed your trajectory as a scientist? Like, how do you see your profession and then your professional duty after this experience?
That's a great question. I think this was always the case, but it really became quite evident during COVID that scientists can no longer work in silos. And I mean that scientists can no longer just work with other researchers in their discipline. They need to work with physicians, they need to work with policymakers, they need to work with other interdisciplinary professionals who offer an important lens into whatever issue a researcher is studying. And that's really important to make sure that researchers are conducting valid science, but also science that is going to move the needle in addressing disparities, promoting health, all of that. But I also mean that scientists can't just work with other PhDs. We've got to engage the communities that we want to serve. We have to really understand the issues in the communities. And again, it's not just about being equitable and being a nice scientist. And so I'm going to interview the people that I'm studying. It's really, if you want to conduct valid science, you have to engage the community.
Jess?
So before COVID, if you asked me what I did or what I do for a living, I would answer that I am a data scientist, a health policy analyst. And ever since this came about and when we launched Unbiased Science, I really see myself first and foremost now as a scientific communicator. And Andrea and I always say, we never received any formal training in communication. So we're kind of learning as we go. But I feel like this is a skill set that I'm still cultivating, but I'm so passionate about it. And it's so evident to me that there is such a need for scientific communication that, especially in the time, as I said before, of social media, people just do not know what to believe. There's too much misinformation out there. And so I see this as my role. This is my passion. And so I see myself continuing down this path, even after COVID.
Yeah, I mean, I echo Emily and Jess. We say it all the time, science is not finished until it's communicated. And that doesn't just mean in our
I love
niche.
That.
that doesn't just mean in our niche of scientists, right? And that means in the communities, that means to policymakers, that means to the general public, that means to clinicians, right? And there are so many brilliant scientists out there that just don't have the skill set to convey their revolutionary data in an engaging manner or in a way that is digestible to the general public. So I think those of us, whether it's formal training or acquired out of need, that have honed that skill set really do have a duty to continue with that. And frankly, I think that graduate training for, science should include digital communication, science communication, all of these types of skills that we've all had to learn on the fly, because it really is a critical and integral part of science is being able to translate it in a way that people can actually, do something tangible with that information.
Well, thank you guys so much for joining today. This is so much fun, and I'm so excited that everyone got to see your brilliance. Seriously, obviously I'm super fans of Unbiased Science, and Emily, come on.
We are super fans of you guys too, of course.
But before I let you go, do you guys want to tell us how we can follow you and support your work? Unbiased Science Pod, I'll start with you guys.
Yeah, so we're on all kinds of platforms. So we're on Instagram, Facebook, Twitter. We're still kind of figuring out in LinkedIn. We also have a podcast, as Andrea said. It's available on all platforms, including Spotify and Apple and Stitcher. Right now we're on hiatus, but we're coming back for season 2 in a couple of weeks. Kind of have to figure that out. But yeah, Instagram is where I'd say we're most active.
Our handle is @unbiasedscipod, and our website is www.unbiasedscipod.com. And you can find, we actually have a searchable database by keyword for all of the sources we've ever used in any infographic. And you can also listen to our podcast episodes directly on the website too.
And Emily, what about you with how can we find neurodiversity?
I'm far less connected, but I actually, during the pandemic, I did join Twitter because I really saw the need to. So my Twitter handle is at Emily Hotez PhD, and you can of course follow me there. The project handle is Neurodiversity Health Chats, and if you're a student at UCLA, you can come take my classes.
Yeah. Nice pub. We'll have all those links in the chat. Thank you guys so much for coming on. We're going to have to do it again. Have a good night, you guys.
Thank
Bye,
you.
everybody.
Thank you.
Bye. That was fun. Love them. So as science advocates, we should keep doing what we're doing and make sure that we're using science for good, keeping our communities protected, and speaking up. And one way we can do that is to help out with the March for Science calls for implementing mask mandates at the state level for your local government, and also stricter mask guideline petitions to the CDC. So you can just kind of click and fill in your information, and we'll send off an automatic email for that so that we can start to tell the people in charge that we're not going to take it anymore. We have a shared responsibility to use science for good and find ways to communicate science to the public in a manner that is relatable and easily understood, to empower the public to make the right decisions, keep their families safe. And to that end, I will leave you tonight with a hilarious TikTok from @HotVicKrishna, explaining how viruses mutate to evade immune detection. Seriously, you guys, it's hysterical.
Fork Hands is out there. Be on the lookout for forks and seize them. Will do. It's him! Get him! Please, no, stop. I'm not Fork Hands. I'm different. Yeah, I guess you're not. Can't believe I almost destroyed him. Replicate me. In fact... It's Fork Hands. Why did you stop him? It wasn't Fork Hands. In fact... Spork Hands. He mutated. It is him.
Seriously, that's a brilliant piece of psychons. I hope you guys got the facts you needed tonight. Thank you for being with us, and we'll see you next time. Good night.